So what is she supposed to do? It's unconscionable, it's unacceptable, and it's unnecessary. She's about to turn 60. I know you said that too, Jackie. She's at a time where she's, running this farm, which is a challenging job, even in a strong economy.
The fathomability of how horrendous this is going to be, because it's just not, he has no frame of reference.
And last week she got a letter saying that her health insurance premium is going to go from $230 a month to $1,077 a month.
Today in Congress, Oregon Representative Suzanne Bonamici sharply criticized Republicans for failing to return to Washington and do their jobs, accusing them of ignoring the struggles of everyday Americans. She warned that their proposed Medicaid cuts and the plan to end premium tax credits would cause health insurance costs to skyrocket for millions of people. Bonamici shared the story of Teresa, a small farmer in rural Oregon whose monthly premium is jumping from $230 to more than $1,000. An increase of over $10,000 a year, money she simply doesn't have.
Thank you, Congresswoman Randall. Congresswoman Bonamici from Oregon.
Well, for being here. Really appreciate your telling your stories. We're here in the Capitol today, in the nation's capital, waiting for our Republican colleagues to show up, to get back here to do their jobs, to save healthcare, to end their shutdown, to lower costs. They seem to be missing and completely out of touch. The American people deserve a government that works for them. And we're just not seeing that right now. They seem to be oblivious to what's happening. I don't think Donald Trump has ever struggled to pay for health care or housing or childcare. And he hasn't struggled. But I know that Oregonians are struggling, too many of them. And now they've already made massive cuts to Medicaid in the big ugly bill. Now they want us to lock in a policy that will increase costs for people paying for their insurance through the exchange. That means millions of people will see their costs increase. About 198,000 Oregonians, including my constituent Teresa. He's from a rural county, Clatsop County, Oregon. And like you, Jackie, she gets her insurance through the exchange. She runs a small farm, wonderful farm. I've been there, produce and flowers. And last week she got a letter saying that her health insurance premium is going to go from $230 a month to $1,077 a month. That's more than $10,000 a year she does not have. So what is she supposed to do? It's unconscionable, it's unacceptable, and it's unnecessary. She's about to turn 60. I know you said that too, Jackie. She's at a time where she's, running this farm, which is a challenging job, even in a strong economy. But she doesn't know what to do because one illness or injury could threaten her life and her livelihood. She doesn't want to close the family business, but she's not alone. And we know that. There are many people across the country who have that same story, and they're getting similar letters. And I tell you that their costs are already high: childcare, housing, grocery. Teresa and everyone in the United States should feel secure and not fearful when they get sick or injured. So I want to ask you, Ms. Broth, will these Medicaid cuts and premium tax credits, ending the premium tax credits, will that only affect people who are on Medicaid or people who get their insurance through the exchange?
Absolutely do not think so. It's going to affect a wide berth of people. And I don't even think that it's difficult to try to get someone like Donald Trump to understand the fathomability of how horrendous this is going to be, because it's just not, he has no frame of reference.
Exactly.
There's no frame of reference. He has no lived experience that translates and correlates to what people are trying to get him to understand. And when you just put blinders on and shut everything down and take your ball and go home, it's easy to just sit, right? If you're not there, you can't listen.
Yeah, the Republicans need to get out there and listen to their constituents, because you're going to hear stories like you are telling us today. And I tell you, it's just outrageous that there are people across the country who are facing this decision. So I thank you again for being here. We've got to stop the cuts and the shutdown, lower costs, and save healthcare. And I yield back.
Thank you, Congresswoman Bonamici. Next up is Congresswoman Norma Torres of California.